I'm Dr. Natasha Beach. I'm a sports and exercise medicine consultant based here at OneWelbeck Orthopaedics. And when I'm not here, I work for a number of sporting organisations such as the Lawn Tennis Association and England Hockey. So tennis elbow is a pain that is associated on the outside of your elbow. So essentially your wrist and your fingers extend. When they extend, the muscles and tendons come together and insert on the outside of your elbow. So people will commonly get pain kind of in this location, but can also feel a tightness or a uncomfortable feeling slightly further down into the arm. So commonly people think that tennis elbow is from tennis. It's a bit of a misnomer. Yes, we do see it in tennis players. However, it can happen to absolutely normal people living normal lives. Generally, there's not a particular trigger for a lot of people, it just comes on. However, if you are sporty, so for example, if you are someone who plays tennis, hitting a backhand, for example, as you pull your wrist through, it puts load on that tendon and that's where you start to get pain. But I say it's not necessarily just associated with tennis, it's any activity that you do that involves pulling your wrist back. So, you know, it could be tennis, it could be cricket, it could be netball. We even see it in rugby, footballers. It doesn't really matter what the sport is, it can happen in any environment. So tennis elbow is about the extensors. The golfer's elbow is about the flexors. So as I explained, tennis elbow is about the extensor tendons coming up the outside and attaching on that bit of bone on the outside of the elbow. Golfer's elbow is the opposite, so it's pain on the inside of the elbow, and it's as a result of everything that's bending over coming and inserting to the inside of the elbow. So anyone can develop tennis elbow. Classically, we see people as you get a little bit older, it is more common. That's more in the people who don't have a particular trigger for why they developed it in the first place. If, however, you're sporty, then it doesn't really matter what age you are, it can just come on at any time. So from a treatment perspective, the mainstay of treatment is a good physio or osteo program where you're really looking to strengthen that tendon. However, it doesn't work in everybody, and so we will sometimes look at doing additional measures to help. So for example, we could give some medication, either as tablets or gels or patches that can help encourage the tendon to calm down. And equally, if that doesn't work, then we can look at doing an injection or something called shockwave therapy, which is aimed to aggravate that tendon a little bit more and let the body then kick in its natural healing process. So generally with injuries, my normal advice at the beginning is give it a little bit of time. If you've had pain for a couple of days, chances are it might start to settle and go back to feeling totally normal. However, if you've had it a week, 2 weeks or beyond, and it doesn't clearly look like it's getting better, that's when I would start to seek advice of getting it assessed. 1, to check that it is tennis elbow, and 2, to start a management plan that gets you on the road to recovery.